Poverty, A Threat to a Life Worth Living by Claire Mackin and Samantha Yates. Through this project, we look to define poverty, show how poverty is currently measured in the United States, and how we believe poverty should be measured. Our primary goal is to present poverty in a way that encapsulates the true societal issues with which we are concerned.
We will start with our basic definition of poverty. Poverty is a state of being in which an individual is deprived of the combined capabilities to live a dignified life. But what does this really mean? This means that poverty threatens our ability to have the basic internal and societal freedoms that are required for a life worth living. Some of these basic freedoms include the ability to obtain an education, live in a safe environment, participate in political debate, and involve ourselves in society without shame or judgment. While most people believe that poverty equates to economic deprivation, income doesn't account for many of these essential freedoms. Nevertheless, income continues to be the primary way the government measures poverty within the United States. Therefore, we will first focus on the benefits and detriments of two different forms of measurement that focus on income, and then discuss some ways in which they can be improved.
The official poverty measure, or OPM, and the supplemental poverty measure, or SPM, are the two measurements currently used today to measure poverty. The OPM is the official measurement used by the United States government, whereas the SPM is used to supplement it. Both measurements look at an individual's economic resources, while the SPM improves areas of the OPM to help better measure poverty. The OPM was developed in the early 1960s and has not been accurately updated for the changing times. The SPM, however, is updated every 5 years. By revisiting the SPM more frequently, policymakers are more easily able to assess the current poverty situation.
In the 1960s, when the OPM was created, the most prominent family structure was the traditional one with a father, mother, and children all living together. Because of this, the OPM defines a family unit as all individuals living together who are related by birth, marriage, or adoption. This family structure, however, is not as prevalent as it once was. Today, we have many other living situations and family structures in addition to the traditional one. Because of this, the SPM has a much more inclusive definition of family. All individuals who live in the same address, and any foster children, and any cohabitors and their children. This SPM definition of family helps better demonstrate the true economic needs of a family.
The OPM does not take into account key government policies including in-kind benefits such as SNAP, and near-cash benefits such as the Earned Income Tax Credit. These benefits assist poorer families and can help increase a family's disposable income. The SPM recognizes the effects of these policies and incorporates them into its poverty measurement.
There are many non-discretionary costs that an individual has simply in order to maintain a job. Such costs may include transportation to work, childcare, and medical care. These costs can significantly impact an individual's disposable income and therefore his or her state of poverty. The OPM does not consider them, but the SPM does.
Geographic location can have a huge impact on the standard of living in a region. An individual living in New York City has a much higher standard of living than someone in a rural town in Kansas. The individual in the city has much higher living expenses and food costs. These costs have a great impact on an individual's economic resources. While the OPM does not consider geographical differences, the SPM does because it recognizes costs differ depending upon location.
While the SPM certainly does a better job than the OPM in outlining the current economic status of a family for reasons we have already mentioned, income is not the underlying motivation of our concern for those in poverty. At the end of the day, we are not concerned with the number of dollar bills a family is earning, but rather the overall well-being and dignity of each individual in that family. Income is used as a means to end, and we have other values such as societal inclusion and physical safety that may not always be obtained through a larger income. Therefore, we need a more accurate way of measuring poverty that more closely resembles these core values and supports our basic definition of poverty.
This is where Amartya comes in. We define poverty as a state of being in which an individual is deprived of the combined capabilities to live a dignified life. But what are capabilities? Amartya Sen came up with two new ways of measuring poverty, one being to measure the capabilities of an individual, and the other being to measure the functionings of an individual. Sen defines capability as an individual's ability to achieve various valuable functionings as a part of living. Functionings, on the other hand, are the various things that he or she decides to do or be in leading a life. In other words, a functioning is the current being and doing of an individual, whereas capability is the potential that an individual has to fulfill a certain being and doing.
So why did we choose to rely on capabilities when identifying and measuring poverty, as opposed to functionings? Take the example of a child who hasn't eaten in 2 days because their mother could not afford to buy her food. In this case, the child is lacking in both the capability to eat adequate and healthy diet, and a functioning, the actual act of eating an adequate and healthy diet. Both a measure of the child's capability and a measure of her functionings give accurate representations of whether this child is in poverty.
Now, take the example of a monk who has given a vow to fast, yet still has enough money and food availability for proper nutrition. In this case, the monk has the capability to eat, yet has not fulfilled that functioning. Therefore, a measure of the monk's functionings is not an accurate enough representation of whether the monk is in poverty.
Furthermore, if we decided proper nutrition to be a basic human right required to live a dignified lifestyle, and the government set a minimum limit per day for the number of calories an individual should eat in order to obtain that functioning, then the government would have the obligation to force-feed anyone lacking in nutrition in an effort to respect that human right. In the case of the monk, the government would then be taking away his basic human right to fast. As a result, it is more accurate to label the capability of proper nutrition as a basic human right required to live a dignified human life. Capability, as opposed to the actual act of fulfilling that capability, is what provides us with choices that allow us to live a substantial lifestyle.
So we've already determined that the capability approach is a more accurate way to measure levels of poverty in the United States. Therefore, what are the basic capabilities that an individual needs to fulfill in order to live a life of human dignity? Martha Nussbaum came up with 10 central capabilities that thoroughly portray what it means to live a life of human dignity. Some capabilities include living in good health, securing oneself against violent outside threats, having the time and resources for play, having normal emotional connections with other beings, engaging in imaginative and critical thinking, and participating in political decisions. It is important to reemphasize here that an individual can have any of these capabilities without taking advantage of them, as can be seen with the fasting monk. Furthermore, Nussbaum states that all 10 capabilities are equally important towards maintaining a proper dignified life. And if one had to choose between two, they would be making a tragic choice. A choice in which any outcome would result in a restriction on that individual's freedom, and therefore a violation of that individual's human dignity.
It is important to note that we focus on combined capabilities as opposed to capabilities alone in our definition. Combined capabilities, or substantial freedoms, are an individual's ticket towards protecting their innate human dignity. Combined capabilities consist of an individual's internal capabilities plus that individual's external freedom. For example, in order to land a job, one would have to have the proper education and training for that job position, as well as the societal freedom to work. We focus on this point last because it is important to note that an individual may look like they have a capability when they really don't. A substantial freedom means that there is nothing, societal or internal, standing in the way of an individual pursuing that freedom. Even if someone has enough money, or has enough education, or is surrounded by enough resources to the point where it looks like they have all of their necessary capabilities, that doesn't mean they do. For this reason, neither total income, gross annual net income, a measurement of an individual's functionings, or even a quick glance at an individual's societal capabilities tells the full story.
The last question would therefore be, how do we accurately measure the combined capabilities of every individual living within the United States? To try to measure all the factors that may impact an individual's 10 capabilities would be a tedious and impractical way of approaching a new poverty measurement. Additionally, simply lacking one of the capabilities may not be reason enough to label an individual as impoverished. For example, say a man has several $1,000,000 in his bank account, has access to good medical care, lives in a good neighborhood, and is able to send his children through a good school system. However, he cannot connect emotionally with his family, friends, and wife and children any longer because he is rarely at home and is always consumed with work. Despite the lack of emotional capability that this man has, we would still not label him as impoverished. Referring back to our definition of poverty, we are not defining those who lack in any of the 10 capabilities to be impoverished. We are defining those who lack in any of the 10 capabilities in a way that prevents them from living a dignified human lifestyle. However, to live a dignified life, one's innate human dignity must not be violated. Some people may agree that this man's long hours result in a violation of human dignity, while others may not agree. Therefore, we would not be able to come up with a measurement that accounts for this lack of capability. In some cases, we will not be able to determine the levels of capability of every individual or whether a lack of capability results in a violation of human dignity.
We need to have some concrete way of measuring poverty in the United States, and we need to set a realistic goal for our measurement. In order to do so while incorporating some level of capability into our measurement, we want to take the SPM and incorporate it into the external or societal capabilities of each community. The SPM already provides a more accurate representation than the OPM of an individual's economic resources required for basic needs. Furthermore, it is evident that within our society today, income is a major factor leading to an individual's ability to obtain basic capabilities. As we have already mentioned, income is used as a means of gaining many capabilities. The more income an individual has, the more likely they will be able to obtain good health, education, shelter, nice clothing, and ultimately respect from their community. However, income does not account for other capabilities such as play, bodily integrity, and sense, imagination, and thought, among others.
In order to incorporate external capabilities into our measurement, we will have to look at each community and ask ourselves if it accounts for Nussbaum's 10 essential capabilities. By maximizing the external capabilities of an individual, we would be better able to maximize that individual's internal capabilities. For example, public school systems increase the chances that an individual will develop the capability to go off to college. Affordable health care increases the chance that an individual will live a long and healthy life. Therefore, the questions we would ask are the following. Is there a decent education system? Is there a safe walk for the children? Is there a community park and other recreational activities available? Is there an adequate health care provider nearby? Are the neighborhoods clean, or is the community next to a dump? We understand that finding a numerical value to define each individual's capability is near impossible. But we believe that these questions can help to identify some of the missing capabilities in different communities. When taking into account these availabilities, along with the SPM's measure of income, we would be able to establish a measure that more accurately represents poverty levels in the United States. Ultimately, this new measure takes a more realistic approach, while still allowing us to keep in mind the underlying motivation for a concern for poverty.